Welcome to the American Indian and Alaska Native Behavioral Health webinar series, presented by the National American Indian and Alaska Native Addiction Technology Transfer Center. I'm Kate Trams, and I will be administering today's webinar. Today, Dr. Jackie Gray will be presenting Disrespecting Our Elders, Elder Abuse Indicators and Screening in Indian Country. This training series is brought to you by the National American Indian and Alaska Native Addiction Technology Transfer Center, or ATTC. The National American Indian and Alaska Native ATTC is one of 4 national focus centers which serves the ATTC network. The ATTC network is a nationwide network made up of 10 regional centers, 4 national focus centers, and a network coordinating office. The map on this slide shows the location of the 4 national focus center ATTCs. To learn more about our center, the network, or your regional center, please visit our website. Our next webinar in this series is scheduled for Wednesday, April 2nd from 1 to 2 p.m. Eastern Time, where Dr. Barbara S. McCready will present Cognitive Behavior Therapy for Substance Use Disorders. In addition to this webinar series, we offer another series titled the Essential Substance Abuse Skills Webinar Series. This provides an overview of competencies from CSAT's TAP 21 publication, Addiction Counseling Competencies. The next session for this series will be held on March 19 from 1 to 2:30 Eastern Time, when Bob Rarrett will present Treatment Knowledge. For more information on our webinar series, you can contact me at the email address or phone number provided on this slide. Our center is a NADAC certified educational provider, and we'd be happy to provide you with CEHs. The cost is $10 to do so. The CEH request form is available for download in the Files pod in the webinar screen. If you choose to download a file, a new tab will be opened in your browser, and you will have to click on the webinar window to return to view the webinar. If you are unable to download the documents from the webinar, please contact me using the information on the slide. Immediately following today's webinar, you'll be redirected to our GIPRA evaluation. We invite you to participate in this brief online customer survey. This survey asks about your satisfaction with the event and will take less than 10 minutes to complete. GIPRA stands for the Government Performance and Results Act, and SAMHSA asks us to evaluate our events in order to comply with this act and provide improved performance assessment and accountability. SAMHSA uses information collected by these surveys to determine how many people have attended our events, your satisfaction with our events, and how useful our events are to you. We hope you'll assist us in gathering information about our services by participating in our survey. Before we start today's session, I'd like to go over a few instructions for the Adobe Connect system. To view the presentation in full screen mode, click on the full screen button at the top right corner of the presentation pod, which may look like 4 arrows pointing outward. To return to the regular view, click the button again. You will be muted for the duration of this webinar. Please use the Q&A pod to share your questions and comments. Your questions will only be visible to me and the presenter. I will pass your questions along to the presenter at appropriate points in the presentation. We will actually be taking specific time for Q&A at the end of the presentation. We would also like you to be aware that this webinar records participant attention time. If you minimize the webinar or are working in another window, the system will record your participation in it as inactive, which may be reflected in the number of CEHs received. The opinions expressed in this presentation are those of the presenter and do not necessarily reflect the official position of CSAT, SAMHSA, or the U.S. Department of Health and Human Services. Today's webinar is presented by Dr. Jackie Gray. Dr. Gray is a member of the Choctaw and Cherokee Nation and is a research associate professor and the associate director of the Center for Rural Health Indigenous Programs in the School of Medicine and Health Sciences at the University of North Dakota. Her work is focused on addressing health, mental health, and health disparities in Indian country, and we're delighted to have her here today to share her insights on issues of elder abuse. Thank you so much for joining us, Dr. Gray, and I will pass things over to you for your presentation at this time.
Thank you, Kate. It's wonderful to be here, and I welcome everyone that's attending today. I am with the National Indigenous Elder Justice Initiative, which is a grant we received from the Administration for Community Living to address elder abuse in Indian country. And so I'll be talking a little bit about some of the things that we're doing with that project today. Some of the objectives today, I'll tell you a little bit about NIEJI, identify the different types of elder abuse, hope to have you understand some of the different definitions and how different perspectives, whether it's legal, tribal authorities, or elders, view those different types of abuse, how to screen for elder abuse, and to know some of the indicators for elder abuse. And I'll also address some of the resources that are available. Now, first of all, our vision of what we wanted with regard to elder abuse in Indian country was to restore respect and dignity by honoring our Indigenous elders, basically returning to the traditional values for our elders. We're in the third year of the grant's first cycle. We understand there will be another cycle, and so we will hope to continue what we're doing at that point. We're working on developing model elder abuse code toolkits to help tribes to integrate elder abuse codes into their tribal codes or laws, and also memorandums of understanding that they can use to work with the state and county officials with regard to cross-jurisdictional issues, which I'll talk about some later. The other major part of our goals for this year is to have a Native American Restorative Justice Conference, which will be in December. And we'll be getting more information out about that. It will be a virtual conference in that it will be webcast, as well as having an on-site participants where that's going to be. And we will have a number of people involved with elder abuse in model programs around the country that will be speaking. And we'll be focusing on respect and honoring our elders. So, what is elder abuse? Well, according to the National Center on Elder Abuse, it's any knowing, intentional, or negligent act by a caregiver or any other person that causes harm or a serious risk of harm to a vulnerable adult. Now, this seems to be pretty general, but we'll get into more specifics of what elder abuse is as we go on. So, what are the legal types of elder abuse? Well, by definition in statute, there's physical abuse, sexual abuse, emotional or psychological abuse, neglect, and along with neglect is self-neglect and financial exploitation. And okay, there's the self-neglect. So when we talk about the different types of abuse, the first thing most people think about is physical abuse. And the National Center on Elder Abuse in 2013 defined physical abuse as the use of physical force that may result in bodily injury, physical pain, or impairment. The types of things that we think about as far as physical abuse are violence, such as striking someone, either with or without an object, hitting, beating, pushing, shoving, shaking, slapping, kicking, pinching, burning, all kinds of physical types of assaults. In addition to that can be inappropriate use of drugs and other medications, use of physical restraints, force feeding, physical punishment of any kind, and anything else that has any type of physical impact on the health and well-being of an elder. When we ask tribal judges what they saw as physical abuse, they indicated maybe an intoxicated son that hits an elderly parent, an elder being hit by an adult child, assault and battery, You hear the legal piece there on grandpa because he wouldn't give the grandson the keys to his truck. And ones that you don't usually think about are an elderly man with dementia hitting his wife. So there is a mental health issue going on with the dementia, but that's the person who's physically acting out against another elder. Now, the Title VI programs are the programs that provide our senior nutrition programs to tribes around the country. There are also Title III programs for non-native nutrition programs for elders. When the directors of those programs were asked what they viewed as physical abuse, they again talked about the hitting, a daughter hitting an elder just because they're frustrated with what types of needs and health factors were going on, a granddaughter slapping an elder, and then drug taking and alcohol use leading to hitting, yelling by other family members directed toward the elder. So here's one of the first times we start seeing the substance abuse coming in as a factor. As far as sexual abuse, this is really any non-consensual sexual contact with an elderly person. Now, sexual contact with any person that can't give consent is also considered sexual abuse. These types of things include unwanted touching, all types of sexual assault or battery, such as rape, sodomy, coerced nudity, sexually explicit photography. It can also include such things as maybe an elder that is bedridden being left totally nude and uncovered, which impacts their dignity as well as not having any choices in the matter. Now, our tribal judges didn't report any types of sexual abuse. They weren't hearing of anything coming to them. However, from tribal health directors, I heard things like grandma was being raped by a male who was high on meth and broke into her house and was so ashamed that she didn't want anyone to know. She wouldn't report or tell anyone. And it took several hours for the person interacting with them to get them to even go to the hospital to be checked out for their own physical health and well-being. Again, our Title VI directors said grandma was raped by a nephew and wouldn't talk and was also ashamed. And also that elders were raped and killed on the reservations. This is because they're more vulnerable. When we move on to emotional and psychological abuse, this is more the infliction of that anguish and pain, distress through verbal or nonverbal acts. It includes things like verbal assaults, insults, threats, intimidation, humiliation, harassment. Treating an elder as if they're an infant, isolating them from their family, their friends, or any regular activities they're used to participating in. And giving an older person the silent treatment, not communicating with them, having that enforced isolation. Sometimes, locking them in their room and forcing that social isolation is another means of the psychological and emotional abuse. Now, again, when we spoke with tribal judges, they talked about drunk or mad relatives that come into the elder's home yelling and scaring the elder, or grown children that move in with the elder and then drinking, fighting, taking their money, chasing away their caregivers, and really causing a lot of distress and the lacking of care for that elder. Family violence can make, a lot of times with the verbal abuse and the emotional abuse can make the elder afraid to even testify against the offenders. And again, confining that elder to one room where they have no interaction with the family. And they also indicated that sometimes the elder will contact the police to remove intoxicated adult children from the home that are taking advantage of the elder or creating problems. The Title VI directors, when they were asked about emotional and psychological abuse, they talked about the children abusing alcohol in the elder's home, verbal abuse by family members, yelling mean things to the parents, name calling, things like that. Children treating the parents and threatening the parents and grandparents that they'll put them in a nursing home if they can't live in their home or if they can't have access to their funds. Now, when tribal elders were asked about emotional and verbal abuse, they talked about verbal abuse to elderly parents, not listening when elders speak, treating them as if they don't matter anymore. And they really focused on the disrespect that was occurring as far as the emotional and verbal abuse. Now, the fourth type of abuse is neglect. And this is the refusal or failure to fulfill any part of a person's obligations or duties to the elder. That neglect could include failure of a person who has the financial responsibilities to provide care for the elder, pay for their home care, health care services, or not paying their bills, failure to pay part of the provider care, any of that that's necessary. Now, neglect typically means refusal or failure to provide that elderly person with life necessities: food, water, clothing, shelter, personal hygiene, medicine, comfort, personal safety, other essentials that are agreed upon as far as that responsibility to the elder. It could include other things, as I'll get to later. When we talked with tribal judges, again, they saw more of the legal aspects where the elder was confined to the home and the family wouldn't provide the support. Or the elder complaining about loneliness because no one would come to see them, or being shut off and isolated. The family not checking on the elder and the elder not being able to take care of themselves. Family going away and leaving the elder without food. Failing to obtain proper medical treatment for the elder. So a lot of this is really that family member or whoever that caregiver is not providing that care. When elders were asked about it, they mentioned things like being locked in a room in the home, or the family not providing care and attention to them that they felt like they needed, or the family was too busy to take care of the elders. A family not visiting or taking the elders to gatherings so that they were able to interact with their friends and family. And lack of that family care and attention as they became older and less able to get around on their own. Abandonment is another issue as far as elder abuse is concerned, and that's kind of defined as desertion of that elderly person by someone who has taken responsibility for providing care of that elder, or by the person with physical custody of that elder. And abandonment is also related to that neglect. I'll go back just a minute. Around the abandonment, as far as an example of that, I was doing some research during powwows during a summer, and we were setting up early at the powwow grounds, and a young man brought his mother or grandmother out and set up a tent for her out at the powwow grounds in the middle of the afternoon in the summer, and it was probably close to 100 degrees. And we went over after we had some of our work done and talked a little bit with her, and she had been left there with no food or water um, for a number of hours before anyone else showed up. So we were, well, we got water to her, and had difficulty with the food that we had there with us, finding something that she could eat because she had lost most of her teeth, and so we needed to be able to find something that she could chew. We were finally able to find some yogurt that we could leave with her to eat. But this elder had basically been abandoned out there without anything to take care of her other than the tent to provide some shade for hours. This could be considered abandonment. Definitely neglect. I think one of the most common types of elder abuse that we find or we hear about is financial or material exploitation. And along these lines, it's defined as illegal or improper use of an elder's funds, property, or assets. Some of the things include, cashing an elderly person's checks without authorization or permission, forging their signature, misusing or stealing an older person's money or possessions, coercing or deceiving the older person into signing a document that such as a will or a contract, improper use of conservatorship, guardianship, power of attorney. Some of the ways I think we see this in Indian country is when the elder gets their check, family members coming over to borrow money, but they never pay it back. Um, Going to buy the elder's medications and then not returning any of the money that's left. Things like this. According to tribal judges, they felt like that the things like granddaughter that wiped out her grandmother's bank account, misusing the elder's monthly check and not paying for their food or bills, so that they end up with their electricity cut off or no food to eat. The Title VI directors talked about family gambling away the elder's only income, taking the elder's personal items, and the family taking the elder's check. The elders themselves spoke in terms of a grandchild taking their car, their only transportation, and wrecking it, or pressuring the elder for money, or the family cashes their checks and then lock the elder in their room, or they borrowed money and didn't pay it back. In another instance, a granddaughter and her boyfriend moved in to be supported by the elder. Another area that isn't necessarily talked about as far as that exploitation is relatives leaving the grandchildren with the elders to feed, clothe, and babysit for indefinite periods of time. That these children then are left to be supported on the little income that the elder has coming in. Something that has come up since we received the grant was the topic of spiritual abuse, which Doble defined as anything that interferes with spiritual growth, including corruption of another person's value system. Some of the things that have been given as examples are denial or limiting an elder's ability to attend spiritual activities or ceremonies, taking their ceremonial items for sale or use without permission, comments or activities which are damaging to the elder's spirit. And Duran call this soul wounding. And I think in the past, many of these types of things have been listed under emotional or psychological abuse, neglect, or exploitation. But the spiritual abuse that we were hearing about goes deeper than that, where it truly is a soul wounding, that it impacts the individual on a much deeper level rather than just the psychological or the neglect or the exploitation factors. And that soul wounding impacts their physical health, their mental health, uh, many factors which may put them into a decline. Some examples, like I mentioned, elders not being taken to ceremonies or spiritual events. They're not allowed to conduct, the family is not allowed to conduct ceremonies in the hospital as the elder's dying. The ceremonial items taken from the elder's home by visitors, families, friends, or others for their own use or for sale. And we also heard about elders who had not been raised within their traditional community, but wanting to have ceremonies at the end of their life, but they have no connections to someone to provide those ceremonies. So a number of factors related to the spiritual abuse. I think I'll stop there for just a minute and see if we have any questions about any of those types of abuse.
Yeah. And if you have questions, please submit them in the Q&A pod. There's a space for you to type at the bottom, and then we'll go ahead and read those questions aloud so everyone can hear the question before Dr. Gray responds.
I'll say that one of the things that we've learned over the last 2.5 years of this grant is we've heard stories every place that we've gone about different types of things that were going on. And a lot of the examples that we have are from the stories that people have told us.
All right, so don't have any questions yet, but I would say I would encourage people to submit questions as soon as they think of them, and that way we'll be ready to address them the next time we can take a break for more questions. So yeah, if you'd like to go ahead, Jackie, I don't believe we have any questions at the moment.
All right, we'll move on. So many times I'm asked what causes elder abuse. It could be caregiver stress. You know, a lot of times one person is given all the responsibility for caring for the elder, and that on top of everything else that they're doing just becomes too much. And any of us, when we get stressed out, we're more apt to become maybe verbally abusive or less patient, less understanding of things. The violence in our society, we're seeing a lot more of that, and that's starting to impact our elders. That sense of entitlement, where people are expect their elders just to, you know, they've helped to support the family over the years, and now even though they're elders, the family still expects them to do the same things that they've done for their life before. Greed. Sometimes it's just, you know, greed and taking things to sell or to buy drugs or other things. And then ageism. Our society has really changed in not valuing our elders in the way they used to be valued. And then power and control, to have that power and control over that elder. And all of those are some of the factors that come into play. I see we have several questions, so why don't we look at those right quick and then we can go back.
Yeah, that'd be great. Our first question I'll read out here. The question is, one other abuse that I did not see is stealing elders' medications to feed own addiction and or using or fueling alcoholism and addiction in order to exploit them. So did you want to respond to that at all, Dr. Gray?
Yes, I didn't have that as a specific, that would fit under the physical abuse as well as the exploitation and the neglect. And that's medication management is really a big issue in Indian country. And several of the meetings that I've been at there, we've addressed some of the things around that medication management. But it can either be taking of the elder's medication, so the elder doesn't receive it and it's being sold. Sometimes it's the elders themselves selling their medication. Um, there are just, sometimes it's the caregiver that takes it, sometimes it's someone else. So a lot of things are being done to try to manage, especially medications around elders to make sure they're getting the medications they're supposed to have and no one else is getting access to it.
Great. I will go to the next question then. I have an elder I work with who has grandchildren who continually ask for money, and she appears to willingly give the money, yet it feels like they are taking advantage of her. Yet she is her own guardian. Would that be considered abuse?
Those are tough ones because, the value system, within our Native communities is if you have something, then you give it. And I think I've seen it myself with some of the students that I get very frustrated with that we're back in their home community and they heard grandma got a check and they want to hurry over there so they can get their share before everybody else gets theirs. Um, and it is that financial exploitation. But I'll talk as I get a little farther along about some of the things and planning that can be done with elders to help address some of those things, so they aren't left without the resources to cover uh, their own needs. I think a lot of times the elders are willing to give the money because the family member indicates that they really need it, but then when the elder is needing it, those family members aren't back and helping to take care of them, so it isn't reciprocated. Good questions, thank you.
Okay, we've got a couple more. The next one is, how do we, as caregiver or social worker, convince an elder to get help or report when an elder does not want trouble from the perpetrator?
And I'll talk about some of those things. One of the things that we're working on with a lot of the tribes is what we call a restorative justice model, where within the pueblos in the Southwest, they've got elder councils that things come before the elder council, and they are going back to more traditional ways of addressing things within their community, such as shaming and, if necessary, excluding people from the community, banishment, if they are not correcting their ways with the admonishments from the elder council. There are other groups that really bring the family together and say, okay, here's what the issue is. How can we do this without necessarily sending someone to jail? Or let's put together a plan that can be followed and try to address some of this without getting the criminal system involved. And family members are much more receptive to those types of interventions that really help to maintain and restore the family than those that are more punitive.
Okay, We have one more comment here. Another form of spiritual abuse can be misrepresenting a person's belief system in death. Would you like to respond to that at all, Dr. Gray?
I'm not really clear unless it's talking about misrepresenting what that elder wants as far as end of life care and things like that. And I think that's something that I'll kind of address it as far as the planning aspects when we get a little farther along.
And then we have one more that just came in. For many elders, especially Native American, it appears that the soul, pain, or hurt is a vital factor as far as elders validate themselves. When restriction, isolations, shaming, etc. take place, is there a format that can stop the abuse or a process that allows the elder to maintain and follow their spiritual beliefs?
I I think there'll be some things as I talk a little more later on about some of the interventions and screening and things like that that we'll get into. So why don't we move on with some of those? And if I don't get it, then we'll come back to it and try to address it.
Great. Sounds great.
Okay. Well, why does elder abuse happen? Elders are very trusting. If a grandchild comes to them and said they really need money to get their books to continue their schooling, and that elder is going to do everything they can to try to help them out, even if it means they won't have their money for their food or their medication. They many times are seen as they're easy to fool or con, and I think that comes along with that trusting nature. Uh, Also, especially in our Native communities, elders are about the only one that may have that steady source of income. Others, it may be very situational. And many times they tend to be in isolation. They aren't integrated in with the family. They may be living alone still, or some way being able to be isolated from any other supports or anyone else knowing what's going on. And then there are probably many other causes as well. So some of the health effects of the elder abuse, we find that there's increased mortality. Uh, those that are abused die sooner. They have poorer physical health outcomes with the problems that they have. They have increased pain because of the stress that they're under with the abuse. Any of the conditions that they already have, whether it's heart disease or diabetes or anything else, are exacerbated because of those stresses. We'll find welts, wounds, and injuries from the physical abuse, and they may not heal as well. And they're much more susceptible to infection when they're under those stresses. So some of the financial effects of the elder abuse, it's too late in their life for them to receive restitution in many cases. They don't have any time to rebuild those assets. They're on fixed incomes. They've lost choices and lost that independence, and a lot of that has to do with if their finances are exploited, then many times they may no longer be able to live on their own or have a choice as to what type of a facility they might want to live in or a location where they might want to live, and less independence as far as that. They have to rely on others to support them and maybe move in with family or go to some type of nursing or long-term care facility. And that lack of resources means that they get down to Medicaid, and then they only have so many choices with Medicaid. Okay, it seems like some things got moved around with putting it into the system. So some of the high risk situations, are people that don't have adequately treated mental health or substance abuse problems are more likely to be abusive. I know I've been asked many times with elders, um, well, if they were abusive or if they used substances while the kids were growing up, aren't the kids just getting back at them by being abusive now when they can't take care of themselves? Well, still, you've got those same issues hitting at both ends. Both the way the elder acted, they really weren't acting as an elder. They were acting more as one of my friends calls it. He was elderly, he wasn't an elder. And he thinks there should be training on how to be an elder, not just be elderly. Uh, if people are stressed or burdened, they're more resentful and tend to be abusive. And that's where we talked about some of the stresses of the caregiver stress, where everything falls on them and they never get a break from it. Sometimes just developing some respite care can make all the difference in the world for those caregivers. And especially difficult is caring for an older adult who's physically combative or verbally abusive. Makes it very hard not to respond likewise. And so those are all high risk situations or red flags that we watch for. Now, in screening for abuse, the best practice is screen everyone. And sometimes it's difficult to bring up those topics. So normalize talking about those difficult things. Talking about, especially with natives, one of the things that we found is when you ask about abuse, no, they've not been abused. They're not being abused. But when you talk about disrespect, then they start talking about the things that are happening and they start asking questions. And that creates that potential to catch abuse in its early stage and prevent it from escalating. So to screen the elder, asking questions, are you being disrespected? And if you are, tell me how. And then you can start sorting out a little bit of what kind of things are going on. Or has anybody hurt you? That would be good to know. You know, when you fell, what was going on? Do we need to go through your house and look for uh, high risk areas? Do we need to do a safety check there to make sure things are okay? Or is there something else going on? Are you afraid of anybody? What, you know, what makes you afraid? Is anybody taking or using your money without your permission? Who takes care of paying your bills? How is all of that set up? How do you know that when they take the money, they actually pay the bill? Is anybody taking your things without your permission? Those are all good ways to get into some of those conversations. And these were some of the things I was talking about around the financial abuse, that planning ahead. Under what conditions would you want someone to manage your finances or to help with your finances? Under what conditions would you want to be placed in a long-term care setting? I know recently I had some questions around my parents and the driving. At what point would it be necessary for you to stop driving? How would we know when it was time? By having those conversations ahead of time, then you can take those responses back and say, okay, you said when it got to this point, this is what you wanted. These are the reasons I think we're at this point. Staying connected with other elders, checking on one another. I call it the buddy system. When somebody that regularly comes to events isn't there, check on them. We just had a report this winter that some elders noticed that a person that was usually at all of their senior activities wasn't there. And so they reported it to the elder care team, and someone went out and checked on her, and she had fallen several days earlier, um, trying to work things out and her heat had gone out in her home, and she had actually frozen to the floor. And if they hadn't found her, she was probably within just hours of dying. But they were able to get her to the hospital, get her recovered, make arrangements, and get her into uh, a care facility so that she was able to receive the care and make sure that she had heat and food and things like that she needed. But it was because someone noticed that she wasn't there and asked the question, have you heard from her? Do you think everything's okay? Being cautious. Don't provide resources for someone without checking out what the situation is, because just to give them resources and someone else is taking them or making use of them isn't going to solve any problems. And then telling people report their suspicions. If you think abuse may be going on, tell someone, because if it comes to mind for you, it's probably needs to be at least checked out, and asking authorities to intervene. One of the things that we found after we received the grant was that there really wasn't any data out there about elder abuse, especially in Indian country. And so the National Resource Center on Native American Aging, which is also housed here at the University of North Dakota, had been collecting data from elder needs assessments for almost 20 years. And so we worked with them to look at that data and found what the indicators were for elder abuse and identified questions that were in that needs assessment that addressed some of those indicators. So unexplained falls is an indicator of elder abuse. And the Native elders who report falling 1 to 4 times a year was almost a third of those that I think there were over 18,000 that had completed the survey for that cycle. So if they're having falls, that puts them in a much more vulnerable way health-wise. And if there are repeated falls, it may be an indicator that either neglect, that there are rugs and things piled up and cords strung and things like that for them to trip over, or that there may be something else going on that's related to their falling, whether it's physical or whether it may be abuse, but it indicates something needs to be checked out. Malnourished or inadequate food. In our needs survey, we found that Native elders reported eating fewer than 2 meals a day, which less than 2 is 1 or none. Almost 1 in 6 were eating less than 2 meals a day. So there's something going on there saying that they're not getting the food or adequate food that they need. Unable or no help to shop, cook, or feed themselves can also be an indicator of either neglect or abuse. Our Native elders reported that they are not physically able. 1 in 9 is not physically able to either shop, cook, or feed themselves, and so they need additional help. They report that they don't have money to buy food. About 1 in 8. As far as family and friends helping them out, over 20% said that they never get help shopping or running errands. Over 40%, they never get help with money. Almost a third never get help with housekeeping or chores. Almost half don't get help with business or financial advice. And almost 1 in 5 don't have companionship from family or friends. So that social isolation that has a big impact. When we ask also, what if these resources, how many of you use them now and how many would use them if they were available? First one, elder abuse prevention. 1 in 200 now use that, but 27 times that many would use it if it was available. This tells us there's a big gap in what resources we have and what we need to have with regard to elder abuse. And I think you can see a number of the others: financial assistance, legal, transportation's a big one, the home delivered meals. Home modification is another big one, that if they had some help in modifying homes and home health care, there's a great number that could use help with that. So these are all things that would be indicators or factors to consider when assessing someone as far as elder abuse or neglect. As far as helping, you can join with us with our activities, working with tribal governments to get elder abuse into tribal code. Only 50 of the over 560 federally recognized tribes have an elder abuse code in their tribal code. Spread the word and share information about elder abuse, their signs, and the resources. Assist locally, trying to identify the problems. Support elder abuse prevention and community awareness. And then Elder Abuse Awareness Day is June 15th each year. Plan some activities for that to help bring awareness to elder abuse. These are some of our partners. The National Resource Center on Native American Aging is here at the University of North Dakota. National Center on Elder Abuse is out of the Administration on Community Living in DC. There are also the National Center on Excellence in Elder Abuse and Neglect is out of the University of California, Irvine. Administration on Aging, Adult Protective Services, Bureau of Indian Affairs, Indian Health Service. We're working with all of them as our partners in trying to address more with elder abuse. And so now take a minute and with Kate's assistance, we'll watch a little public service announcement that we put together. This is a Nez Perce elder that helped us with this to put these taglines that are spoken in English in his native language. Okay.
I just wanted to say before I start the video, if you had your presentation in full screen, you'll want to take that out of that now, so then you'll be able to see the video as it plays.
I stand for dignity. I will not stand for elder abuse.
The time is now. Unite against elder abuse. Break the silence.
Elder abuse is not traditional. Elder abuse is not our way.
Okay, and then Dr. Gray, did you have anything you wanted to follow up with before we take some questions?
I'm sorry, I was just talking away and was on mute.
I was
Uh,
doing the same, so I apologize to everyone for that little delay there.
well, no, I had it on mute here, so that was my fault. What I was basically saying is it depends on the jurisdiction of the nursing home that the elder is in. If it's a tribal member in a state facility, you get those cross-jurisdictional issues, and it may be need to be handled within the state system rather than within a tribal system. And we're trying to get some material so that there's a better with the Tribal Law and Order Act. There's supposed to be better communication and working between uh, the states and the tribes. And so we're working to try to help facilitate some of that.
Great. And yeah, please submit any other questions at this time. We've got a few more minutes for questions, so please continue to submit those. Um, well, actually, I'll run through a little bit of my follow-up, and then we'll see if any more questions come in before we close this out. Um, I'll just show this slide for your contact information in a moment, and then let me just go through these last few slides. Please stay online as we close out the webinar so that you can be redirected to our survey. Also, watch your email inbox for our follow-up, which will include a link to the recording of this webinar, as well as a handout so you can review